Recently, headache experts at a symposium in Los Angeles reviewed how effective and safe natural products are for migraine. Dr. Richard Lipton, meeting chairman, discussed the studies, the evidence for the use of complementary medicine recently reviewed by the American Academy of Neurology, and the guidelines they published.
Based on the studies, the Academy classifies treatments as having level A evidence, meaning established efficacy, level B evidence, meaning probable efficacy, and level C evidence, meaning possible efficacy. So the only, of the natural products, the only one that has Class A evidence is Petasites or butterbur. It's an extract of the root of the butterbur plant, which is in the daisy family. That is what butterbur looks like. It's been used in folk medicine for cough, rhinitis, and headache for hundreds of years.
Two reference quality studies demonstrate Petasites or butterbur has established efficacy. It works. How does it compare to prescription drugs?
Just to provide a frame of reference, I picked one of the topiramate pivotal studies. The patient populations are very different in these studies, so results aren't comparable. My point only is that the range of response is not tremendously different for a natural product and for a prescription drug we judge to be highly effective.
CoQ10 is found to be possibly effective based upon research, and magnesium has some evidence for efficacy. And feverfew and riboflavin?
So riboflavin or vitamin B2, when we look at efficacy, there are 3 studies that I selected here, although in fact there are a lot more.
One key study, in 55 patients, riboflavin was compared to placebo.
The magnitude of the reduction in headache days is large. The difference in responder rates is actually quite impressive. Now, I actually personally use riboflavin in kids quite frequently because, it's very safe and possibly effective.
Feverfew?
The evidence for feverfew is mixed.
Dr. Hans Christoph Diener discussed the safety of these natural compounds and how they're tolerated.
What's the issue about tolerability and safety? This could be very short. I simply could say there is no issue. The only side effect we see with magnesium, and if you increase the dose slowly, this is usually not an issue, is diarrhea.
Riboflavin? Other than a minor change in urine color?
Again, no tolerability or safety issue with riboflavin.
Likewise for CoQ10 and feverfew, no tolerability or safety issues. With butterbur, some patients reported burping, a couple had a bad taste.
Now there are post-marketing data available, and these identify 10 cases of possible reversible hepatitis. And I participated in this expert panel where all of these cases were reviewed by hepatologists. And they went in great detail through all the 10 cases. In 9 of them, liver biopsies were available, and there was only one case where they clearly saw a relationship between the intake of butterbur and a reversible hepatitis. So the incidence, if we look at all the prescribed or bought butterbur, is about 1 case in 175,000 patients.
A much, much lower likelihood than seen with other common neurology medications. Does the product brand matter?
With respect to butterbur, I tell them to buy the Lind Pharma Weber & Weber brand on the grounds that it's manufactured in Germany, the QC is good, and how the extraction is done really matters. And it's very difficult to know which other formulations have had the toxins removed and contain the appropriate active ingredients.
You heard from Richard Lipton that you have to have a very sophisticated method to extract the compounds in the plant that cause liver toxicity. And therefore it really matters whether a patient buys a drug or the natural product that is properly produced.
I think for butterbur it really matters. For B2 and MAG, I don't think it really matters very much.
In summary, for the compounds that I reviewed, there are no major issues concerning adverse events or safety for natural products for migraine prevention. And I think in particular, patients who are afraid of adverse events, they had bad experience with drugs, and they ask me, can you recommend something where I will not have weight gain or tiredness or depression or whatsoever? I think we really should try these compounds, in particular if you look at the success rate, which is not too different from drugs like topiramate, valproic acid, beta blockers, and so on. Thank you very much.